UNANIMA International's official statement on family homelessness and COVID-19. UNANIMA International is a coalition of 22 communities of women religious and a new group of friends, serving in 85 countries with 25,000 members. For over 18 years, our focus has been on women, children and girls, migrants and refugees. These groups disproportionately comprise the homeless populations of our world, though are often hidden statistically and otherwise overlooked. It is our mandate to ensure that these groups are able to achieve a better quality of life through having their voices heard at the international level, as was exemplified most recently in the United Nations 50th Commission for Social Development, where UNANIMA International presented research and advocated for the issue of family homelessness to be given the necessary concern and attention by member states, civil society, and all political actors alike. Our statement in response to the COVID-19 crisis comes after reflection on the lack of attention to family homelessness within the pandemic's global media coverage and international politics. As the situation worsens, it is wise and ethical to consider a sector of society still marginalized. People experiencing homelessness in all its forms are vulnerable. Combined with often poor nutrition and other health issues largely linked with economic standing and issues of access, they are at great risk of contracting the virus. This risk has been escalating as inequalities between and within nations are increasing in accordance with disjointed governmental responses. We have, as a society, a duty to care for all people. Adequate housing is a human right, and according to the United Nations Special Rapporteur on the Right to Adequate Housing, Milani Farah, housing has become the frontline defense against the coronavirus. The provision of adequate housing and accompanying actions for prevention and in response to family homelessness are essential to realization of the United Nations 2030 Agenda and other social, economic, and cultural rights and international laws. Nations in particular should consider their commitment to protections for children, outlaid in the UN Convention on the Rights of the Child. At the expert group meeting on homelessness in Nairobi, Kenya, experts including Jean Quinn, Daughter of Wisdom and Executive Director of UNANIMA International, identified 3 domains that must be satisfied to eliminate homelessness: social, physical, and security. Home is a place where each of these domains are obtained and guarded. Consideration of the natural environment is essential to discussions of security generally. But when we speak about home in the context of COVID-19, above all, it must be a place where individuals and families can remain safe from the pandemic. However, homes also must allow for the achievement of families' holistic well-being. Remaining at home should not pose physical or psychological risk, nor should it cause hunger or violence. We must also recognize that there are psychosocial resource deficits within a pandemic, as well as tangible ones. For example, emotional capacity to deal with the problem and resulting situations may be diminished as a result of past traumas, the compounded effect the pandemic creates, or the traumas resulting from the experience of global pandemic within conditions of homelessness or housing insecurity. Therefore, we need trauma-informed responses and services. Recent commentary from the United Nations Secretary General, Antonio Guterres, has brought attention to women and girls vulnerable to domestic abuse and violence during times of quarantine. The United Nations also reported, displaced and stateless women and girls face heightened risk of violence amid the coronavirus pandemic. Unfortunately, it is an international and generalizable truth that there is a risk to many women within this period of COVID-19. However, some of these individuals and families have not been framed as living in conditions of homelessness as they should be. There's a huge engendered economic factor reinforcing these risks. Many, though not all of these occurrences, take place when people are doubling up, which can be psychologically or emotionally unsafe when someone is remaining or forced into unhealthy relationships. The relationships themselves may also be strained or deteriorating as a result of the physical conditions. Additional problems include an inability to isolate and vulnerability to rejection from the household. Being doubled up is physically unsafe when too close proximity to other people spreads disease faster. Additionally, spaces within which people are doubled up may be physically unsafe due to the structure of the shelter or the greater area of residence. Slum conditions make residents more vulnerable to the spread of the disease. They have less access to water and sanitation, and the access that they do have is often communal or in the form of business-operated services. Housing conditions are generally small and close together, and doubling up is a common occurrence. In the context of a pandemic, these conditions mean that medical intervention in the space would be difficult or dangerous, and that isolation may be impossible. Slum communities differ around the world in their relationship to governance and infrastructural design. These two elements are most relevant to how COVID-19 can threaten a community. UNANIMA International recognizes unsafe or forced living conditions as a sign of invisible homelessness, as clarified in our recent research publications. A fear that is being increasingly voiced by UNANIMA International's members and in the United Nations civil society space is the difficulty there will be in preventing the spread of the disease if and when it reaches certain political environments, such as slums, where there will purportedly be a lack of supported care and also treatment. Additionally, the risk to Indigenous communities already faced with non-community-led development and struggles to sustain control over their land and homes must be acknowledged and addressed by governments in proximity with these groups. World Health Organization Director General Dr. Tedros Adhanom Ghebreyesus stated, "This is a tragedy which is already affecting many families. Many are losing their loved ones. Anyone dying is a daughter or a son of somebody." Evidently, the virus is not the only risk to homeless and housing insecure families around the world. From major European cities to indigenous territories to slums of South Asia, people are going hungry during the coronavirus pandemic. Families and individuals are suffering in the enforcement of the lockdowns and being criminalized and issued with policy fines for being outside despite their financial necessity to do so. Families living in temporary accommodation, including children, are not able to access basic necessities and the tools they need to take part in virtual education. We ask, what moral or just nation can allow its citizens to live without their basic needs, safety, or dignity? Reporting from our members and other good practices, we assert the need to provide access to information, to sanitation, particularly hand washing, and health monitoring services as a good start for these of our sisters and brothers. This pandemic has shone a light on the ways in which, as a society, we forget about people among us who have nothing. In the wake of the COVID-19 crisis, we must recognize and act towards meeting the needs of all levels and categories of the homeless, especially homeless and housing insecure families. UNANIMA International puts forth the following recommendations. We call for member states to follow the recommendations outlined in the UN 58th Commission for Social Development's priority theme draft resolution. We refer to and reiterate all of United Nations Special Rapporteur for Adequate Housing, Leilani Farah's response, including suggestions for moratoriums on evictions and consideration that the provision of adequate housing may require the implementation of extraordinary measures as appropriate in a state of emergency, including using vacant and abandoned units and available short-term rentals. We assert all homeless services globally must adopt holistic, trauma-informed care. We reiterate UN Secretary General Antonio Guterres' call for governments to make addressing domestic violence a key part of the pandemic response. We call for specific consideration of homeless families as part of response plans relating to COVID-19, as well as all humanitarian response plans. We recommend immediate government-initiated increases in opportunities to further women's education that fit employment needs and demands. We call for ensuring technology access to homeless and low-income children and families for educational, informational, and support purposes. We assert the need for socio-emotional techniques to be used in children's education to avoid and reduce trauma from the COVID-19 crisis. We reiterate the suggestions of Indigenous activists for halting development projects on and near Indigenous land to reduce the risk of the virus's spread in their communities and for continued cross-sectoral efforts to combat climate change. We reiterate the importance of a multi-sectoral, coordinated approach to address the needs of homeless families during this time of crisis. We call for governments of all levels to obtain and maintain meaningful partnerships with civil society and organizations who are already addressing the needs of families and individuals affected by this crisis and who are systemically left behind. Thank you.